I'm going to give you some quick tips on how to gain rapport quickly and how to kind of set the initial dynamic to make your patients feel more comfortable. And so, as a lot of you guys may know, my individual story with how to communicate with patients and learning how to do that really started in my personal life. And a lot of the techniques and things that I do when communicating with patients had to do with a lot of experimentation, a lot of things that I not only read but went out and tried when it came to my dating life. So I'll share with you just kind of a quick story. I had been starting out really early, like trying to figure out how to get over my approach anxiety and going out to like bars and different venues to try to approach women to just spark conversations with random strangers, that not just women but men, but random people that I never met before. And one of the biggest things that I got frustrated with initially was that people weren't as receptive to really chatting, even just kind of small talk, or even just kind of slightly in-depth open-ended questions to try to sprue conversation. And I remember one specific instance when I was really getting frustrated in the first week or two of going out and trying these things is I would come straight up to either a group of girls or a singular woman, either standing at a bar, sitting at a bar, and I would kind of come up to them face on. And if you've ever tried to come up to a person like straight up to them, a lot of people's first reactions is typically one of hesitation. And so they'll kind of like either pull back or they'll be a little wary. And so what I got frustrated with is it seemed like these patients weren't receptive to conversation. What I actually found is that it's just our regular defense mechanism when it comes to going up to people and being approached by a stranger head on. And some people can see that as a little more threatening. And so this epiphany kind of happened when I was just sitting at a bar and I was kind of frustrated that night, and someone had sat next to me. And it actually was a guy, and he was just kind of ordering his drink or whatever, and I just happened to lean to the side and be like, "Hey, what do you think of what's going on in the news here?" And there was some event going on at the time in the area that I was doing medical school, and it was kind of an epiphany because I just asked a very simple open-ended question and he wouldn't stop talking. And I was like, whoa, what just happened? So I tried it again. I was sitting at the bar. The guy, we chatted for about 5 minutes. He left. And then a group of girls just kind of came, sat down. I said, you know what? I'm going to just kind of try this again. I'm not going to turn and face them. I'm just going to kind of ask a kind of over-the-shoulder question to them. And so I had actually just gotten a dog that year, and it was a little puppy. And so I pulled a picture up of my puppy on my phone. His name was Caden at the time. And I just went, hey, what do you think my dog's name should be? Because I hadn't decided on a name at that point. I said, this is my new puppy I got. What do you think about what his name should be? And this girl, unknowing to me, was going to just launch into this huge conversation about how she loved dogs, all of these type of things. Just a whole bunch of different pathways that we ended up talking about animals in general, and how I had talked to her about I had a snake and all these things. And I tried that kind of technique a few times, not approaching people in a head-on fashion or creating environments that would make them feel more comfortable. And so I didn't realize the utility of this until I got to be an intern or in my last years of medical school. So instead of usually in the ER, what I would usually do would be to come up to a patient and say, hi, I'm Dr. Carbone. Nice to meet you. I'm going to be the resident taking care of you or attending taking care of you. What's going on? What brought you to the hospital? And a lot of the times in those scenarios early on, I would approach the patients face on. And it always seemed like the patients were a little hesitant about telling me stuff. And so I kind of reflected back and I thought, let me try something different. And so what I did was, instead of immediately going right up to the patient, what I did was I kind of started to walk towards them and then turned my body and either sat on the bed next to them, or sometimes I would be on the computer kind of at an angle with them, but still making a little bit of over-the-shoulder eye contact. And what I found, for whatever reason, and I think it has to do with our kind of primordial or primitive reflex to really protect ourselves from someone we don't know, is by coming in a perceived non-threatening way like that, in a way that's a little softer and less direct, patients tended to open up to me more. So when I asked them open-ended questions, they would feel more comfortable. They would elaborate on things. When I would ask more poignant questions, they wouldn't hesitate as much. And I found it to be very useful. And so what I found, and the tip really I want to give people, is when you're really approaching a situation with a new patient or even a patient's family member that you've never seen before, try to approach them in a way that's a little kind of softer, or gives them the opportunity to feel more comfortable, and less that there is a big power dynamic between physician and patient, physician and family. And so by doing this, by positioning yourself with that type of body language, you can actually create this huge open interaction where they start to feel more comfortable, they start to build more trust. And so that technique is something I've really found to be super valuable. And then the last technique that I want to talk about is something that's super important to me as well, because I feel like it's part of the human element of medicine. So think back to whenever a family member was sick, or whenever a family member had an unlucky circumstance. Maybe they lost a big football game or baseball game, or maybe they were trying really hard to accomplish something or get an A on a test and they didn't quite get it. They got like a B or a C, but they tried really hard. Well, those people, our loved ones, feel a disappointment, or they feel scared, or they feel frustrated. And so one of the biggest things we do, what's the first thing we tend to do? We give them a hug. We use almost a therapeutic touch or embrace to really put them at ease or make them feel more comfortable. And whenever I'm interacting with patients, especially when it has to do with giving patients bad news, is I kind of use this therapeutic touch or human touch in a very kind-hearted, gentle way in order to build that kinesthetic rapport, that physical kind of rapport with patients that allows them to trust me more, to allow me to show them that I'm a human being too. I know where you're coming from. I'm treating you like I would a family member that's going through something difficult. So sometimes if I'm giving bad news and I ask the patient's family, say their loved one is intubated, what did your loved one enjoy when he was himself? Was it reading? Was it going on walks, walking the dog? And they'll usually tell me some type of story that really gives just a small hole into their personality as they were as a complete human being. And so then what I'll do is I'll use a reflective statement like, oh, that sounds like they were a pretty adventurous person, and I'm sure this is very tough for them, knowing that they have to go through this, and it's tough for you to see them have to go through this, knowing how adventurous and independent they are. And just putting my hand gently on like their knee or their shoulder, something that shows that I care. I really care about what is going on, and that I'm here with you as a teammate and as kind of your guide through this difficult process. And I find that really does help open up patients more so to the fact that this person who's talking to me is not just a doctor or some type of healthcare provider, but they're a human being that cares. They really care about what is going on with my family member, my loved one. And I found that these type of conversations and these type of things are really the most fulfilling. And honestly, a lot of my colleagues, this is the reason why we came into medicine, is because we wanted to connect with people on this type of level, because we wanted to help them in the suffering of their loved ones as they went through it. And so by using these little type of techniques during these interactions or during this communication, really will set you up for success when it comes to talking about the difficult subjects of what should we do with someone on life support? What would the patients want in these type of scenarios that we need to be prepared for in having those conversations? Or what should we do next? Should we still be doing what we are doing in full aggressive care? Or has this kind of been enough for them? Has this been to the point where they wouldn't want this anymore, and it wasn't a life that they would deem worth living at this point, knowing that the likelihood of recovery is very slim? And so I find that really helpful and useful in helping to kind of persuade and guide my patients in the direction that they want to go, but also in the way that they knew their loved ones would want to go, which is the penultimate most important thing of doing what the patient would have wanted done for themselves. And I'll say one kind of final thing as we wrap up, as far as like any kinesthetic touch and building rapport that way, is that giving your family members a hug, sometimes it's very hard, especially those that withdraw care, have someone die that's been rolled into the ER after a cardiac arrest. Just giving them that kind of warm embrace and touch that a family member would give to them, showing that we did everything we can. And it hurts us too to see our patients like that. It's very difficult when we have to undergo those things as human beings. It's difficult, and the most difficult for families, but it's also difficult for us as healthcare providers. Sometimes we can compartmentalize, but other times it's difficult. And just by giving those embraces to those families over the course of my career so far, I've found that it's not only therapeutic for them, but it's therapeutic for us as healthcare providers. And it really helps build trust amongst the community and healthcare providers and our patients. And I think it's something that we're slowly starting to get back to as technology is bringing us closer to patients more, and we're spending less time on our computers and doing other administrative tasks. And so I hope these tips kind of help you out as you navigate very complex interactions with your patients in communication. This is only two small aspects of how we communicate, and there's going to be plenty more to come. And I hope you enjoy it, and I hope you're able to talk about these things with your supervising and collaborating physicians and healthcare providers, and really do as best you can for your patients. So I thank you guys for tuning in.